On April 6, 2026, a passenger aboard a luxury Antarctic expedition cruise started feeling unwell. Fever, fatigue, a headache that would not stop. The crew assumed seasickness. Nothing serious. 5 days later, he was dead. As the MV Hondius sailed from Antarctica toward Europe, carrying 114 passengers who paid up to 22,000 euros for the trip of a lifetime, the virus spreading through that ship was forcing the world's top infectious disease scientists to question something they had believed for 30 years. Hantavirus was never supposed to spread between humans. They were wrong. Hantaviruses belong to a family of viruses carried by rodents across every continent except Antarctica. For decades, the rule was simple. Humans became infected only by breathing in dust contaminated with rodent droppings, urine, or saliva. The virus would linger in abandoned sheds, barns, or cabins, places where mice or rats had nested. Once disturbed, these particles could become airborne, invisible, and deadly. The infection route was always the same: animal to human, never from person to person. This pattern held true for outbreaks from the American Southwest to rural China. The 1993 Four Corners epidemic in the United States, driven by the sin nombre virus, killed 13 people, all linked to exposure in rodent-infested areas. No human-to-human spread was ever confirmed. Scientists categorized hantaviruses as classic zoonoses, a threat to those who ventured into wild places or lived in close quarters with rodents. Then a single strain in South America began to break all the rules. Andes virus stands alone among hantaviruses. In 1995, investigators in rural Argentina and Chile documented clusters where caregivers fell ill days after tending to sick relatives, despite never encountering rodents. Genetic sequencing showed more than 99.9% identity between viruses found in the index patient and secondary cases. That was evidence that pointed to direct human transmission. The pattern intensified in 2014 when a single infected man in Rio Negro, Argentina, passed the virus to his son and 2 visitors. All 4 developed hantavirus pulmonary syndrome within days of sharing a cramped, poorly ventilated room. Laboratory analysis revealed viral loads in saliva reaching 100 million copies per milliliter at the peak of symptoms, enough to saturate droplets expelled by a cough or even a breath. Superspreader events like this shattered the illusion of safety in close quarters. Unlike sin nombre and other hantaviruses, Andes virus could leap from person to person, especially where people shared air, surfaces, or caregiving duties. In the confined decks and cabins of a ship, this anomaly became a nightmare scenario. Subscribe for more true stories that challenge what we think we know. April 1st, 2026. The MV Hondius pulls away from Ushuaia, Argentina, carrying 114 passengers and 61 crew. 5 days later, the ship's medical officer records a passenger with fever, chills, and muscle pain. Those symptoms are dismissed at first as seasickness. By April 11th, that same passenger is dead. The official cause is still unknown. The ship continues its course, but over the next 2 weeks, more travelers fall ill. On April 24th, the deceased spouse is evacuated at St. Helena, only to die in Johannesburg 2 days later. Then on April 28th, a crew member collapses and cannot be revived. The vessel anchors off Cape Verde as panic spreads below deck. Laboratory results do not arrive until May 6th, confirming Andes virus. By then, the outbreak has claimed 3 lives, and the ship's doctor faces a crisis with no clear treatment, only isolation and hope. On the MV Hondius, the illusion of a mild viral illness shattered within days. Patients who seemed stable in the morning could be gasping for air by nightfall. Andes virus follows a brutal script. After an incubation period that can stretch from 1 to 7 weeks, the first phase mimics the flu. Fever, headache, aching muscles. Then the body's defenses turn against it. The virus attacks the cells lining blood vessels and unleashes a torrent of cytokines that make capillaries leak. Lungs fill with fluid as if the patient is drowning from the inside. Oxygen levels plummet, and even mechanical ventilation can become useless. In 2 cases, the only hope was ECMO, a drastic measure that pumps and oxygenates blood outside the body. Yet with no approved antiviral and no vaccine, care remains supportive and desperate. Of 11 confirmed cases, 3 died. An appalling 27% fatality rate, despite modern medicine's best efforts. Disease outbreak news alerts began landing in rapid sequence. DON 599, then DON 600, then DON 601, each one escalating the urgency. As the motor vessel Hondius approached Tenerife on May 10th, health authorities mobilized a web of containment, quarantine protocols were activated at the dock, medical teams worked in full protective gear, and a roster of passengers and crew was divided by risk. Disembarkation was staggered and controlled. Contact tracing fanned out across 12 nations, with hundreds of potential exposures logged for monitoring. Flights were rerouted, and border officials in Europe, Africa, and the Americas coordinated to intercept anyone with symptoms. The machinery of global public health moved at full tilt, straining under the pressure of a virus that refused to respect old boundaries. For decades, Andes Hantavirus claimed lives in the shadows, striking rural families in Argentina and Chile, where intensive care unit beds are scarce and ECMO is a distant hope. No licensed treatment exists. The virus was labeled an orphan disease, left behind by the economics of global health. Only after Western travelers died aboard the MV Hondius did the world's attention and funding shift. $12 million from PAHO, $5 million from the Gates Foundation, and new vaccine grants arrived almost overnight. Yet for years, families like the couple lost on the ship faced this threat alone, their suffering invisible until tragedy sailed into view. Andes virus still has no approved cure, just a 20 to 40% fatality rate and a warning: medical certainty is fragile, and nature exploits every blind spot. Subscribe for more untold truths.